साइड में लगा लो एक क्लियर।
Done, sir.
Okay. नमस्कार, मैं डॉक्टर आलोक रॉय। हर हफ्ते की तरह इस हफ्ते फिर again this Saturday we are meeting between 5:30 to 6:30 to discuss about the health is the ultimate wealth and some topics which can help you in getting better and living a better quality of life. This time, what has been bothering us for quite some time, that our number of patients who need dialysis have just gone up in last decade or so. And when I was talking to my nephrologist, and what they told me was eye-opening. They said that a lot of youngsters, when they are kind of deteriorating, if we can catch them at that point of time, then we can prolong their good quality of life and allow kidney not to fail so early. But unfortunately, in absence of a common understanding, in absence of knowing how to take care of a kidney, and when the problems start, what are those issues which lead to the kidney failure ultimately, can be prevented, and one can live a good life. Because once kidneys have failed, whatever you do, you will not get back. There is no way of reversing the process of kidney failure. We can just treat them. We have to put them on a long-term dialysis or transplant. They say the kidney patients don't die of kidney failure; they die of financial failure. So, with those few words, I would like to pass on today's address to Dr. Rohit Rungta. Dr. Rohit Rungta is our senior consultant nephrologist, has been with us for many years. A very dedicated, hardworking nephrologist. We are very proud of him. With this, I hand over to Dr. Rohit Rungta. Over to you, Rohit.
Thank you, sir. A very good evening to everybody here and to our respected chairman, sir. First of all, my heartfelt gratitude to the sponsors and our respected chairman, sir, for organizing this very beautiful platform for raising the awareness about kidney disease. As sir aptly said, kidney problems are increasing over the last couple of years like anything. Just like the COVID wave we have seen over a couple of years, kidney problem, the burden of kidney disease has increased manifold. We cannot deny this fact that the burden of kidney disease has increased over last 5 years, I would say. More and more patients are going on dialysis. More and more patients are undergoing transplantation. More and more patients are being detected with kidney problems with increased creatinine. However, there is also some good thing about it. So let's first talk about this increasing trend. Why is this increasing trend being seen over the last couple of years, whether it was not there beforehand? It was there, but because of many multifactorial factors, we are seeing this increasing trend. First and foremost, I would say diabetes. We would come about this a bit later on in my talk. Diabetes, India is a diabetic hub. And the most common cause of CKD, which we were discussing right away, is diabetes. Other causes I would discuss a bit later. The second, which is equally important factor, which because of which the kidney problems, the burden of kidney disease is increasing, I would say, is patients' awareness. So over about 5 years back, about a decade back, people were not aware that he or she might land up with a kidney failure, kidney problem. So now I would say patients are more aware, people are more aware that they can have a kidney problem. If they have a kidney problem, the creatinine is high, they see a nephrologist. The third important point is physicians are referring patients earlier to a nephrologist, which plays a very, very important role in managing a patient with CKD. So earlier, this trend was not seen. We would have been seeing patients with a creatinine of say 4 and 5, at which point we would have done nothing. So now we are getting patients who are detected with a creatinine of say 1.5 or 1.8 and 2. So at this stage, this is the stage where we can halt the progression. This is a stage where the disease can be reversed back. This is the stage when it can be curable. This is the stage when we can detect the acute factors, which is actually leading to the progression of the disease and which can be prevented. Fourth important point is the diagnostic modalities. So we all know now that 2 simple tests, just a serum creatinine level, a simple blood test, which is very cheap, and a urine routine examination, which is again very cheap. And it is easily available all over the place. So I would say just these two simple tests can detect whether you have a kidney problem or not. We'll again discuss this in elaboration a bit later. So overall, kidney burden, kidney disease is increasing because of multifactorial causes. The good thing is that we are now more aware, we have a more better understanding of the kidney problem, and because of which we are able to prevent it at a much larger scale. Less patients are going on dialysis, even though they are CKD, they are diagnosed CKD, but less patients are progressing to end-stage renal disease because of a better understanding, because of better management of these cases. So coming to what are the most important causes of kidney diseases. Right. So coming to what are the important causes, why our kidney fails. So as the traditional teaching is, the most important cause of kidney failure is diabetes, by far the most important one. And we all know India is turning. The world data have suggested that India in the next couple of years will be the hub of diabetes. Almost 50 to 60% of the patients of diabetes will land up in kidney failure. So we need to catch these patients early on. We need to modify his treatment early on so that the progression can be halted. The second important cause of kidney failure, CKD per se, since our talk is limited to CKD, chronic kidney disease, because these are the patients who goes on dialysis and transplantation. So the second most important cause is hypertension. Blood pressure, increase in blood pressure other than diabetes can result in CKD. As a matter of fact, both diabetes and hypertension are usually seen synonymously. Most of the patients are suffering from both of these diseases. So these compound the effect, compound the deleterious effect of each other on kidneys and lead to rapid progression. The third important aspect, the third important point which can lead to kidney failure is usually nephrotic or nephritic syndrome, which are usually less common. However, they need to be treated at the onset of the disease, and it can prevent the progression again. African origin peoples are known to progress to CKD if they have diabetes and hypertension, and otherwise also their genetic makeup makes them more prone for CKD. Another important aspect which we are seeing more commonly in our Indian subpopulation is obesity because of the westernization of the diet. Most people are obese nowadays, and obesity is again one of the causes of kidney failure over a period of time. Smoking is another important cause which can lead to kidney failure. Old age. So there is a natural age-related progression in kidney diseases. So the traditional teaching is after the age of 30 years, our GFR is the function of the kidney which progresses, which measures how healthy your kidney is. We'll come this also on our next slide. Another important point where the kidney fails is use of over-the-counter drug, which is very common in India. So you just visit a pharmacy, you say you have having a pain here and there, they prescribe you, they give you any painkiller, which can again harm the kidney. So NSAIDs in particular, taken over a very long time at a high dose, can result in kidney failure. We do see many patients who take over-the-counter drug for the arthritis or the chronic back pain, and they land up with increased creatinine. So in this talk, what we'll discuss is how do we keep kidneys healthy? And we'll also discuss some myths and facts. I'll clear some doubts about what is the amount of water intake, which is the most common question I get from patients every day. What is the amount of water that one should drink? I'm having a good urine output, therefore my kidneys are healthy. This is a misconception. We'll discuss this also. We'll also discuss about the symptoms of CKD or the symptoms of kidney problem. So how do we detect whether you have a kidney problem or not as early as possible? What is the treatment? How do we treat whether it is curable or not? And I'll also discuss about the protein restriction, which is also a very common question, which we discuss every now and then in our clinics. How much protein intake should we take? Should we reduce it completely? Should we reduce it to zero? Should we take it at a slightly lower dose as recommended for the normal population. We'll discuss all these in our next slides. So how do you keep our kidneys healthy? So before that, we will come to know what our kidney does to our body. So the kidneys are two vein-shaped organ, kidney-shaped organ, about the size of one's fist. So this is the size of the kidney one has in our body. There are two kidneys, each located below the rib cage, both on the side of the spine. The basic functional unit, at the cellular level, what is the functional unit? The functional unit of the kidney is known as nephron. So nephron is the unit which produces the urine, which filters the blood to excrete the toxic materials from the body and preserve the non-toxic materials, which is again returned to the body. So the nephrons are the basic urine producing structures of the kidney. So just for general information, the right kidney is generally slightly smaller and lower than the left. This is God made actually, and to make space for the liver on the right side. So we have a liver which occupies a much larger space, and therefore the right side of the kidney is slightly smaller and slightly lower as compared to the left. Each of the kidney measures around 150 to 170 grams, and each size of the kidney is 9 to 14 centimeters. So this is important because in CKD, what we use as a diagnostic tool is your shrunken kidney, a shrinkage in the size of the kidney. So if the kidney size decreases over a period of time, along with other parameters which we use for diagnosis, the patient is stamped as CKD. So a tough fibrous renal capsule surrounds each kidney. So there is a covering, there's a tough fibrous capsule so as to protect the kidney from trauma, from blunt trauma. And beyond that, two layers of the fat serve as protection again. The adrenal gland, which have a different function, are placed on top of both the kidneys. So what is the role of the kidney in our body? We all know that kidney plays a very, very important role. There are many, many functions which a small kidney does all day. So kidneys are mainly responsible for filtering the waste products from the body. So whatever waste toxic materials that are generated in the body is filtered off by the kidney. It also filters off the excess water. So it manages the hemostasis of the body and other impurities out of the blood. They manage the fluid level and the electrolyte level. So the sodium and the potassium levels and the calcium levels are all managed by the kidneys. So kidney is a very, very small organ, but it does a lot number of functions. Another important function is they secrete hormones, which is basically erythropoietin and renin, and also vitamins, which plays an important role for blood formation. So we all also know this, that when the kidney fails, when a patient develops CKD, when the creatinine starts increasing, he simultaneously also develops anemia. This is due to the fact that the kidneys are the organ which produces erythropoietin. Erythropoietin is a chemical, I would say, which increases the blood production, which acts on the bone marrow and causes blood production. So a deficiency of erythropoietin in CKD, when the creatinine increases, causes anemia, a low blood level, hemoglobin level. Renin is an important organ which manages the blood pressure. So increasing the renin causes increase in the blood pressure. So it's a double-edged sword actually. So blood pressure, as we have discussed earlier, can damage the kidney, as well as when the kidneys are damaged, your blood pressure can shoot up, which is usually most commonly seen in CKD patients on dialysis. They have very, very high blood pressure all the time. So as we're discussing it, the kidney plays a vital role in blood pressure management, and they also maintains the pH. pH is the acidic environment of the body. So our body is a composition of alkali and acid. So kidney plays a very important role in managing this acid and the alkaline milieu in the body. So understanding the concept of kidney health, we need to know about kidneys and our health. What are the kidney diseases that can affect the kidney? How to keep the kidneys healthy, and how do we manage the kidney disease? So whenever we search for kidney diseases, the risk factors for kidney disease on Google, the first and the foremost factor which comes down is diabetes, as we have discussed. Hypertension is the second. Third important point, which I missed out earlier, was family history of diabetes and hypertension. So if you have family members, if you have father, mother who are suffering from diabetes and hypertension, you have fair chances that you can develop diabetes and hypertension as well. And also you have fair chances that you can develop kidney problems. So how to keep kidneys healthy? a healthy kidney requires a multifactorial approach. Again, it's a comprehensive, holistic approach, I would say. So you should keep yourself fit and active, should eat lots and lots of fruits and vegetables. If you are smoking and you have increased creatinine, stop smoking. Smoking is known to increase the filters, the pore size of the filter that is inside the kidney. It increases the degree of the proteinuria. And the more protein is released from the kidney, the more extensive damage it produces to the kidney. So our target is to reduce the proteinuria, and for that you have to reduce or stop smoking. As I said, do not take over-the-counter pills, especially the painkillers, on regular basis, which are prescribed, which are given without prescription. Regularly monitor your blood sugar and blood pressure levels. Keep it at a very, very tight control. Drink enough water every day. So this was the topic which I had put in myths and facts. So a regular amount of water, around 2 to 3 liters per day, is very, very essential for keeping the kidneys healthy. This is also a myth which I hear every day. How much water should I drink? I have kidney problem. I have a creatinine of 1.5. What we see in general practice is most of the patients are advised to drink a limited amount of water because he has a creatinine of 1.5 or 1.8, which is again completely untrue. You should drink whatever urine you are passing. If you drink less amount of water with a creatinine of 1.5 and 1.8, your body gets dehydrated, as well as the kidneys get dehydrated, and that might increase your creatinine further. So rule of thumb is drink enough water as far as you are passing good amount of urine. So let's take a look at each of these individual points. So lifestyle tips for keeping the kidneys healthy. First, tip 1 is stay connected with your healthcare team, which is very important. So we have seen patients who does regular checkup of creatinine and urine routine, but please do connect with your healthcare professionals, be it your family physician, be it your local physician, be it a nephrologist, anybody. But do connect with them, to talk with them, do regular tests, talk to them regularly. Tip 2 is manage your blood pressure and monitor blood glucose levels. So over the time, high blood pressure can damage the blood vessels in your body, reducing the blood supply to organs like your kidney. So kidney is a highly vascular organ. It requires almost 20% of each cardiac cycle output that is thrown out of your heart. Kidney consumes almost 20% of that blood. So this blood pressure management is very, very important. Keep your blood pressure under strict, tight control. The normal recommendation for a good blood pressure control is anything below 120 by 80. This 120 by 80 blood pressure control has shown to produce less damage to kidney progression. Likewise, high blood glucose can also damage the blood vessels in your kidney. So the basic pathogenic mechanism is same. Increase the blood glucose level also increases the pore size of your filters. It increases the protein amount that has been released from the kidney and further damages the kidney. Tip 3 is take your medications as prescribed. So for blood pressure, for your sugar levels, for your uric acid, for calcium, all the medicines that have been prescribed by you should be taken at stipulated time. Do not miss any of these medications. Tip 4 will be maintain a healthy weight and be physically active. So maintaining a healthy weight has a number of health benefits other than on the heart and on your overall body. It gives you a better control of your blood sugar and as well as of your blood pressure levels. So doing regular exercise, keeping yourself fit can actually reduce your blood pressure and blood sugar levels. And over a period of time, you would monitor that you are requiring less number of pills for controlling your blood pressure and blood sugar. So at least try to get 150 minutes of a week of moderate aerobic activities. Get enough sleep. So as with any other disease, as with any other healthy lifestyle, most adult needs around 7 to 8 hours of sleep every night. So getting enough sleep may have many benefits, including lowering your risk of serious health problems, reducing your stress, and improving your mood. As I said, tip 6, do not smoke or quit smoking if you're already smoking. In addition to other risks, especially of those lung cancers and all the other risk factors that smoking has, it can slow the blood flow to your kidney. To be blunt as possible, it just reduces the blood supply in your kidney and make kidney disease worse. Quitting can be difficult, but your doctor can offer suggestions to help you. There are many new drugs which actually can help you with with quitting. So what is chronic kidney disease? We hear this term a lot. Most at times a patient people are stamped with CKD, and most of us fear CKD, chronic kidney disease. So chronic kidney disease is progressive loss of kidney function over time. So this is completely different from acute kidney injury. So that if we divide the kidney diseases into two broad classifications, one is acute kidney injury and one is chronic kidney disease. So in acute kidney injury, the loss of the kidney function has happened suddenly. There are various causes of this. So this AKI, acute kidney injury, is actually preventable if treated on time. Chronic kidney disease, on the other hand, is a progressive loss of the kidney function which occurs over a period of time, say 5 years, 10 years, 15 years down the line. This chronic kidney disease, this progressive loss of kidney function, can lead to end-stage renal disease. So CKD has different stages, stage 1, 2, 3, 4, 5. 5 is the last stage, and 5 is the stage which is also known as end-stage renal disease. So when I say end-stage renal disease, I mean when your kidneys are not working at all, and you require another support to maintain a healthy body, which is usually in the form of dialysis, which can be peritoneal or hemodialysis or a renal transplant. So kidney disease can lead to other health problems, including weak bones. As I said, it produces a hormone, vitamin D. It leads to conversion of vitamin D into the active form of vitamin D, and a deficiency of this vitamin D can actually lead to bone pain or weak bones. It can also damage the nerve and can result in chronic malnutrition. So chronic kidney disease is a silent disease and may not have any warning signs. So we'll discuss this also in myths and fact. So what are the symptoms of chronic kidney disease? I would say no symptoms at all. That's the whole reason why we focus in every awareness program about the importance of doing two simple tests, creatinine and urine routine. The moment you do a urine routine and a creatinine, which are very cheap, it hardly costs less than 500 rupees, I would say, you can detect whether you have a kidney problem or not. The next step would be to evaluate further, why is the creatinine high, or why is the urine routine showing protein or RBCs in urine. So it is basically a silent disease. All the symptoms that we hear about the kidney problems, like vomiting, loss of appetite, edema, swollen feet, swollen eyeballs, swollen eyelids, a loss in weight, all these things are seen at a very last stage, almost on the stage of CKD stage 4 and 5. So in the initial stages, say CKD stage 1 or 2, you might not have any symptom at all. The another myth is, I am having a very good urine output, how can I have a kidney problem? So this is again very untrue. So it again depends upon the kidney, whether it's producing a good amount of urine, is it producing a low amount of urine. So in both the situations, you can have a kidney problem. So just for an example, when the creatinine is high, your kidney might not be able to filter the blood properly. It might not be able to absorb the urine that has been formed properly. In these cases, you have a very good urine output. So you have a creatinine of say 2, 3, 4, but you are passing urine output of around 3 to 4 liters per day. And most of these patients think that since they are passing a very good urine output, they cannot have a kidney problem. So chronic kidney disease, as I was discussing, there are various stages to this. We go from stage 1 to stage 5. All of these stagings are based on the GFR. So GFR is basically a functional, how much the kidneys are functioning. We calculate the GFR by various methods. The most common method that we use is the measured GFR, the estimated GFR actually. So we have your creatinine level, we have your body weight, and we have your sex, and we put it in a preformed formula and we get the GFR. So a word of notion here, GFR cannot be calculated when there is acute kidney injury, as I was discussing earlier. So this formula, this staging is only for chronic kidney disease patient. As for example, you just suffered acute gastroenteritis and the creatinine is high, right? So you had a baseline creatinine of say 0.8, you had acute gastroenteritis, severe loose motion and vomiting. After a couple of days, your creatinine has gone up to 2. So in these cases, we cannot measure the GFR. You should not measure the GFR. Why I'm focusing on this is because nowadays we get most of the lab reports where they mention the GFR there. And most of the patients on seeing the GFR, low GFR, are very, very much worried. I've seen patients with a normal creatinine where the GFR is 40, 30, and they think that they have a kidney problem. No, this is not kidney problem. We should monitor your creatinine level. We do the GFR, yes, but only when you are stamped as CKD, when you are diagnosed as CKD. So based on GFR levels, we divide CKD into stage 1, 2, 3, 4, and 5. So as I said, stage 5 is end-stage renal disease when the GFR or the function of the kidney falls below 15 ml per minute, or in layman term, I would say 15%, right? So if the kidney function is less than 15%, it's stage 5, it's end-stage renal disease. So something about the global prevalence. What is the health burden of CKD in all over the world? So the global prevalence of CKD is almost 1 in 5 men and 1 in 4 women in the age group of 65 to 74 years are suffering from CKD. However, almost 1 in 2 adults above the age of 75 are CKD. So chronic kidney disease, who is affected? About 10% of the population worldwide is affected by CKD, which is huge number. And the healthcare burden because of the dialysis, because of the transplant, because of the large number of medications that a CKD patient has to take are huge. Kidney disease can affect peoples of all age and races. So as I was saying, we are seeing more and more young patients suffering from increased creatinine, high creatinine. These are because of various reasons, but yes, we are seeing younger patients now developing CKD. We are seeing younger patients developing nephritis. We are seeing younger patients developing urinary problems, stone problems. Half of the people age 75 or more have some degree of CKD based on the definitions, which we just showed you about the GFR. And 1 in 5 men and 1 in 4 women between the age of 65 and 75 have CKD. So what are the risk factors? To recapitulate, the risk factors for CKD are high blood pressure, it's blood sugar levels, if you're a smoker, if you are aged above 60, if you're using over-the-counter painkillers, if you're obese, if you have heart disease, and if you have a family history of diabetes, hypertension, as well as family history of CKD. So coming to signs and symptoms of chronic kidney disease, as I said, I have put down very few signs and symptoms, very randomly seen signs and symptoms. And as you would see from this chart, all of these are very non-specific. So there's no particular symptoms which is per se seen in kidney problems through which you can diagnose that, yes, I have this symptom, so I have a kidney problem. No. All of these symptoms that I've put down here are very non-specific. So you can feel tired, you can have trouble in sleeping, you can have dry and itchy skin, you can have an urge to urinate more and more, especially at the night time. You can have blood in urine, you can have frothy urine, you can have pain over your back, you can have edema, you can have puffy eye, poor appetite, and muscle cramps. But please be sure that all these symptoms, even if it is related to kidney, even if it's related to CKD, is seen at a very last stage. So earlier stages of CKD can have no symptoms at all, nothing at all. So what are the treatment options? I have discussed this already with the CKD stage 1, 2, 3, 4 medicines. We can retard the progression, we can halt the progression. It is not curable, yes, but the progression can be retarded, the progression can be halted. So the time to which you land up in dialysis can be prolonged as long as 10 years, can be prolonged as long as 20 years. So after stage 5, which is end-stage renal disease, there are 2 options left. Dialysis, which can be hemodialysis, blood dialysis, or can be peritoneal dialysis as well. And the other option is renal transplantation. So how do we manage? See your doctor for regular checkup at a regular interval. Manage your diabetes, have a good healthy blood pressure. Know your family history, because as I said, family history of CKD, family history of diabetes and hypertension can predispose you to developing CKD as well. Take medications as prescribed and do not take the painkillers, over-the-counter painkillers. Stop smoking, limit alcohol, eat healthy, run daily. 30 minutes per day is enough for you for 5 days in a week. Aim for a healthy weight, be active. Dietary modifications, I think this is a very long topic in itself, so we'll discuss at a later stage. We have a KDIGO guideline, we have a KDIGO body, the recommending body. This is a very large body all over the world of all the nephrologists, which formulate some points every now and then. So KDIGO CKD guideline recommend that patients should perform 30 minutes of moderate intensity exercise most of the days of the week, and exercise training is more likely to be successful if we have moderate intensity, relatively inexpensive, simple and convenient. And more vigorous exercises requires increased supervision but can be safely prescribed to patients with a broad range of comorbidities and may be associated with greater gain in health. So how do you manage kidney problem? Educate yourself, which is very, very important. You should be aware what you're having. You should be aware what drugs you are taking. You should be aware about the diet that have been prescribed to you. Educate yourself, your family, and your friends about your special diet. Eating out, talk to the manager or ask for ingredients list. So there are particular lists which should not be followed, which you cannot eat, which are very, very detrimental to the kidneys. Find info and encouragement in a CKD group. So talk to peer groups, talk to groups of CKD people, talk to group of patients who are undergoing dialysis. In our hospital, we have a good friend circle of patients who are on dialysis. They talk to each other, they feel good, they come together, they go together. So there's a group of people who have bonded together because of the dialysis, because go into these groups, talk to them. Set up a healthy, organized kitchen, improve your health, and save money by cooking on your own meal. And I think we skip this. Right. So as I said, kidney disease, particularly CKD, is incurable. Don't be misled by this. AKI is completely curable. Don't be afraid of this. So when I say CKD, it's incurable. Prevention is the only cure. Prevention is possible, and it is in our hand. We both together can prevent the progression. We can both together prevent the progression of CKD from going into dialysis, from going into transplantation. Thank you very much, sir.
Thank you, Dr. Rungta. You all will agree that he has done a great job of explaining how to, what are the causes of chronic kidney disease. Now, my question to Dr. Rungta is that, Dr. Rungta, you said that 20% of the men have a kidney disease, and 25% of women. What is that preponderance of women for kidney disease, and why?
So I think horrible milieu, patients, female patients, because of the hormonal activities, because of the hormones, more seen in estrogen probably plays a role. So there's no hard fact, there's no trials which has shown that what is the basic reason why female are more exposed, more prone to develop CKD. But probably there were some studies a few years back which showed that estrogen might have a role in this. I'm sorry, but we don't have hard facts about this, sir.
So it's kind of natural finding, not corroborated by any hard facts. It's just gender bias.
Right.
Dr. Rungta, one more thing. You said there are no symptoms. So the only way probably, as you have said correctly, that go for a checkup regularly. And if you have a family history, and if you have obesity, you need to be careful about your kidneys from the beginning. As long as you are aware of that you have a kidney problem, then probably you'll do a checkup. So regular checkup can't be overemphasized. Is that true?
Yes, sir. Absolutely, sir. So as we are very much aware of heart problem, I think, so most of the people above 50 years, 40 years of age does a regular ECG, if I'm not wrong. So my point is, when you are above 40, at least do a creatinine level every 3 months or 6 months. That is enough. So just keeping a tab on creatinine levels can prevent you from progressing, can prevent you from developing CKD. So the earlier it is detected, sir, that is the point where we can harm it the most, where we can catch hold of it, and where we can start the treatment.
Yeah, your point taken. And especially because there are no symptoms. Like normally when you have heart disease, you have pain in the chest. When you have a liver problem, you have a jaundice. When you have a hernia, there's something bulging out. But in kidney disease, till you have gone down, as you said earlier, that the production of urine also may be significant. you may be producing 3-4 liters of protein. Yeah. Any role of the urine test examination in identifying kidney disease early?
Absolutely, sir. So along with creatinine, I would also recommend urine routine examination. So what we see in urine routine examination is the degree of protein that we excrete. So at times we can detect there are RBCs in the blood, RBCs in the urine. At times we detect there are protein excretion in the urine. So a rule of thumb is most of the patients who are diabetes should do a urine routine examination, and we can quantify the protein that is being excreted. So based on this protein excretion, we can predict how rapidly you will progress into the end stage. So the target, the basic very idea of doing a urine routine examination is to reduce the degree of proteinuria. So suppose we did a diabetic patient of say 5 years or 8 years of history. We did a urine routine examination, and the protein, when we quantify the proteinuria, it's around say 500. And the another patient who of same duration of diabetes has a proteinuria of say only 100. So this 500 patient, these category of patient requires more extensive approach, more strict approach. So because these are the patient who will progress more rapidly. So this distinction is necessary. This distinction can be done only with a urine routine examination. And at times I am not surprised, I will not be surprised to say that at times we have also seen patients who are diabetic, who are passing proteinuria, and who are also detected to have RBCs in the urine. So RBC is a hallmark of inflammation which is going inside the kidney. We have done biopsy of these patients. These patients have been referred from outside actually, and they have been labeled as diabetic nephropathy. So the kidney damage was initially thought to be because of the diabetes. So, but when we examined the patient again, when we evaluated the patient again with a simple urine examination report, we found that he was passing RBCs. We did a kidney biopsy and we found that he had diabetes, yes, but he also has a nephritis along with it, which was completely treatable, and that retarded the progression. So the rate at which the creatinine was increasing, a simple urine routine examination led us to a kidney biopsy, and the kidney biopsy led us to a nephritis. The nephritis was completely treatable, and his creatinine actually decreased.
So I think, as you have explained so beautifully, that nothing but caution and realization that 10% of population will go into kidney failure. So the only way you can stop it by preventing it early, and the only way you can stop it by being careful. So as if I can just sum it up, he said that hypertension, diabetes, over-the-counter medicines, obesity, and smoking. If we are aware of these 5 things and lead a healthy lifestyle where we control our diet and exercise, there's no reason why will kidney fail. Especially please remember that kidney failure, if the kidney fails and has reached to the stage 3, stage 4, then it becomes an irreversible process. And also he has distinguished very clearly that acute kidney failure is completely manageable. And also he has said that don't worry about acute kidney failure, can be managed. He also said that in diabetes, sometimes you have got a comorbidity in kidney in terms of nephritis, so which can reduce the kidney problem to the base normal level. Okay, Dr. Rohit, thank you very much. It was very, very enlightening. There are no more questions from anybody. So we'll conclude the session here, and thank you again profusely for sharing your knowledge. Listeners, every Saturday we come to you in a webinar series, Health is the Ultimate Wealth. 5:30 to 6:30, please join us. And we have this session is co-opted by Bengal Chamber of Commerce and Industries and Rotary Club of Kolkata, Vienna, who take our messages to all of you. Stay healthy, stay fit, and we want you fitter than coming to the hospital. Have a nice day, nice weekend. Thank you, Dr. Rohit.
Thank you, sir.
Thank you. Thank you.